team. Here are the symptoms we're dealing with. Nintendo thumb, ascending cholangitis, and parachondritis.
Based on these symptoms, it could be a few different things. I'm leaning towards a liver issue with the ascending cholangitis.
I'm thinking more along the lines of a joint problem, maybe, related to the Nintendo thumb and parachondritis.
What about a rare genetic disorder? These symptoms could be pointing towards something like aldolase, a deficiency.
I agree with Randall. Aldolase deficiency could make sense, especially considering how rare it is.
Damn it, we don't have time for guesses. It's aldolase deficiency. We need to perform nucleotomy immediately.
But sir, nucleotomy is extremely risky. Are you sure that's the right move?
I'm certain. We don't have a choice. Prepare for surgery, all of you. The patient's life is in our hands. You asked to see me, Tracy?
Yes, Hawks. I heard you want to perform nucleotomy on your patient with aldolase, a deficiency. Where did you get such a stupid idea?
Well, I saw a juggling act involving scalpels at a medical conference, and it got me thinking.
Hawks, this hospital does not experiment on patients. It's reckless and unethical.
But Tracy, this patient's condition is deteriorating rapidly. We need to try something different.
I understand your concern for the patient, but we cannot risk their life with unproven methods.
It's not unproven, Tracy. It's just not commonly practiced here. Your unwillingness to compromise might cost this patient their life.
I will not compromise on patient safety and the ethics of this hospital, Hawks. Find another way to treat the patient.
Fine, Tracy. I will find another way. But mark my words, there will come a day when innovative treatments like nucleotomy will be accepted in mainstream medicine.
Leslie, we have a problem. The patient is in critical condition after the nucleotomy.
Oh no, that's terrible. We need to do something immediately. Forget about telling Hawks for now. We need to focus on saving the patient.
But Hawks needs to know that nucleotomy was not the right treatment for aldolase deficiency. He needs to understand the consequences of his decision.
I understand, Frank, but right now the most important thing is to stabilize the patient. We can figure out how to approach Hawks later. Let's focus on what's urgent.
All right, you get the shock paddles, I'll wet the sponge.
What sponge? What sponge? And what for?
Are we trying to shock the patient back to stability?
That probably isn't even necessary. This isn't the Green Mile, Frank. He probably just needs an adjustment in medication.
You idiots. You almost killed the patient with your incompetence. Wrong nucleotomy and wrong diagnosis. How could you be so reckless?
We were just trying to follow the best course of action based on the evidence we had, Hawks.
Maybe it was a difficult case, but we did our best.
I still think we were on the right track with our original diagnosis.
I agree, we just missed a few crucial details.
Missed details. You missed the whole damn point. You are a disgrace to this profession. I can't believe I have to work with such a bunch of imbeciles.
It's not our fault you've continued to stick by us on a literal case-by-case basis. First, you've got to declare what we're going to do, then sob and bitch when we expectedly screw it up.
Gary's right, Hawks, for once.
Just what is your problem, man? Is your job so boring that you needlessly complicate things? You didn't have to tell Tracy about the scalpel juggling act?
He didn't tell me either, Randall. When was this?
Johnson and I crashed a medical conference last year. Tracy originally was going to send you and Kelly to it, but she made the mistake of making me give them to you.
Jesus. Wasn't that the same weekend the three of us made the patients participate in wheelchair races?
Who won?
Probably anyone related to the patients that not only lost, but didn't survive. It made headlines.
Or I'm out to here. Figure out what the hell you want to do. I've got lunch waiting for me. So, how's everything going in your personal life, Johnson?
Oh, you know, same old, same old. Trying to juggle work and family time. It's a bit hectic, but we manage.
I see. Must be tough. Reminds me a lot of that motivational speaker we saw at Hospital Con 2023.
God, that was insane. How has he only lost 2 fingers his whole career juggling scalpels?
He lost those to his starving parents when he was a kid. He only took up juggling medical equipment when he realized Mommy and Daddy feared doctors. Perfect coping mechanism.
What the fuck?
I'm just kidding. Anyway, I've been analyzing this patient's case we discussed earlier. I think I may have just figured it out.
Oh, really? That's great news, Hawks. What's the diagnosis?
It's a rare condition that presents with subtle symptoms. I need to confirm a few more tests, but I'm quite certain now. Sorry, Johnson. I have to go. I'll update you later.
Wait, what? You're just leaving. Well, I guess that's Hawks for you. Always in a rush.
Sorry I'm late, folks. Had to rush in here.
Hawks, where's your protective gear? You can't just storm into the or like that.
Yeah, Hawks, you're putting us all at risk. Have you lost your mind?
Listen, forget all delays of deficiency. That's not it. I'm telling you, it's human. To primate transmission.
Human to primate transmission? What's the prognosis?
Well, it's not pretty. High mortality rate, but we can contain it with aggressive treatment.
Are you sure about this, Hawks? That's a bold claim.
Trust me, I've seen the symptoms firsthand. We need to act fast to prevent an outbreak.
Let's gear up, everyone. We have a new enemy to face.
Thanks, Tracy. It was a tough case, but I'm glad we got to the right diagnosis in the end.
You did a great job, Hawks. But what's with the swipe at your colleagues? They work hard too.
Come on, Tracy. You know some of them are clueless. This wouldn't have happened if they were more competent.
Hold on a second, Hawks. You were the one who initially diagnosed the patient incorrectly. Don't try to shift the blame.
Well, my team's diagnostics led me in the wrong direction. It's not all on me.
You can't just pass the buck, Hawks. You need to take accountability for your own mistakes.
You just don't understand the pressure we're under. I was trying to juggle so many things at once.
Juggling scalpels, really? That's a reckless idea, Hawks. You can't justify that.
It was a metaphor, Tracy. You should have paid more attention when I brought it up.
Metaphor or not, your approach was risky. You can't blame others for your errors.
I have to go, Tracy. Let's agree to disagree on this one.
Fine, but don't think you can escape accountability, Hawks.